lectures in. Hello everyone, welcome to your NHS Skills Forum. I am Verona, one of the lecturers at Middlesex University, and we have.
I'm Shauna, I'm a technician here in the clinical skills team at Verona. We've only just really been here a few months.
Yep.
But we've had some background in the NHS,
Yes.
and also it's been very lovely working and seeing how nurses and midwives train to get to where they are. That's Verona.
Okay, so what we're going to do, if you follow me, we're going to take you around and let you see some of the delights of West Middlesex University. So first, let's take you in to this room, and this is what we call our wet room. So this is a room where we do things like venipuncture, catheterization, anything like that. If you come here, this is where you'll be practicing those skills.
And as you can see, it's set up for catheterization at the moment for some lessons for tomorrow.
Okay, and if you follow us, show you some more things here. Now this is a really interesting room and it's very nursing orientated. So this table here is where we would show our students how to wash their hands. So instead of using water, we've got the waters over there, but you can utilise using hand gel. And then we've got this fantastic little infrared device that will show you how effective you have been with washing your hands. So that's one table here. And then this table here, amazing. So for those that are feeling a bit queasy, this might not be great for you, but this is just showing you different kinds of wounds a patient might have when they're in the hospital environment or at home. And in the course of your training, if you decide to go into nursing, you will be learning about different wounds. Okay. And of course, we've got a mannequin here, a child mannequin, and we've got loads of different types of mannequins here that will be used throughout the course of whatever course you might be on. Okay. And then we've got here, this is called Hungry Baby. So this is the Hungry Baby mannequin. So this is just utilising ways we can feed children, and also we would use this on an adult size one. So we've got things like a nasogastric tube. So when a person cannot feed, it goes into the nostril, down into the stomach, and we teach people how to do that. Okay. And then for those that are here today, unfortunately you're online, so this is like a jigsaw puzzle we put together here for you to see how great you are at your anatomy. So this is where it's important that your biology, that you're learning, that you really get to know that, because this shows you how and where different organs go. Okay.
And if you'd like to follow us in, we're going into a room where if you love your gaming and maybe you love technology, you love as you see our colleague James demonstrating, I love it, the Oculus headsets, which we use to do our virtual reality training. So these lessons are a way of, especially been very helpful during the pandemic, where people haven't had access to, in-person treatment, in-person teaching. They've been able to experience scenarios in a virtual capacity to be able to maybe engage with different patients, different conditions in a way that they may have been limited to otherwise. And also, even now that we're going back to maybe normal learning, it's a way of experiencing different situations that you may not have experienced yet on placements. You may be limited in that capacity. And it's also quite a fun way of learning to be able to put a headset on and immerse yourself in a virtual environment as a way of learning different skills and learning a bit more in-depth knowledge about different conditions.
And also it's a very, very safe way of learning these skills, because you're doing it in a safe environment, because of course you can make mistakes and learn from those mistakes instead of going into the clinical placement and doing it for the first time on a real life patient. So it's absolutely amazing and well utilised here.
Let's follow us in. Midwifery room now, which has been set up for OSCEs.
So when we talk about OSCEs, we're talking about structured objective clinical examination. So sometime during your time, whether it's nursing or midwifery, you will be doing OSCEs. So this is a way of assessing the skills that you've learned. Okay. So this is how it will be set up, and we have different numbers for the bays, and behind each one. So if you come to this one, and this one is midwifery focused. Okay. So this one, it's all set up for a breech birth, which is a baby where the bottoms come in first. And what the student midwife would be doing would be demonstrating their ability to safely deliver that baby with the different maneuvers. Okay. And then this one here demonstrates another scenario where you might have to do emergency resuscitation of a baby. So this is what this is for. And this is called a resuscitator. And these are the kind of stuff that we would do. And then over here, this could be a postnatal assessment. So you could be looking after mom and baby, doing blood pressure, temperature, pulse, all that kind of stuff. Okay. And then over here, for those that were coming in today, this one is what we call an abdominal palpation. So there's a baby inside, and then we would teach you how to feel and assess where the baby's lying. And just for those at home, I will let you hear our baby's heart rate. Okay. And I think we've got one more room.
One more room again. We're going into our lovely simulation ward now. This room has many mannequins in. It's a way of simulating a real ward environment. And when we go, we've got a new development going in Saracen, Rugby Club, in Stonehead. We're going to develop into, we're going to have 4 of these wards. We'll get you to experience, you know, what a real life ward may look like, experience. Okay, I might start from here and come back this way. So we have a lovely mannequin here that we call Lucina. She gives birth in many different ways. This is an excellent mannequin for especially the midwives to experience, you know, again, they may not experience other than, you know, normal healthy births on their placement. But again, it allows them to experience birth made from and it's a very high fidelity mannequin. And when I've seen the midwives come in and train on it, they love it. Yeah. I think when you learn things in theory, it's obviously good for putting it to practice in a safer way, not hurt a real person. It's very helpful. And we've also similarly got a lovely baby. This is again a very high fidelity piece of equipment mannequin. It's called Super Tory. This is, you know, a newborn baby, and she does everything as well. And it gives, you know, again, like you've seen, allows. Sorry about the noise. Allows, you know, the training midwife, not training midwife, student midwives, and also the child nurses as well, a chance to experience different conditions that, you know, are very unlikely to happen. They can happen. So really, on their placements, they may not experience it. You can. So, and last but not least, obviously, we'll find our other little man here. We have Jane again, demonstrating our biomedics. Different headset now. Our biomedics HoloLenses. So again, if you're a fan of, you know, different technology and gaming, you know, you love this augmented reality stuff. And it allows people, the difference between this and the virtual stuff is that you've got a real mannequin here. When you put the headsets on, as you can see on the screen what James is seeing, it allows you to see the different layers. And this is mainly what we'd use this for, is for anatomy training. We also can practice an ultrasound scanning on it, but we don't really, that's not really part of our curriculum at the moment, but it's still a good insight. If you just want to fiddle around with it, it's still a good insight about learning different anatomy. As you see, James, you can go as close as you can. The heart, you can go inside the heart. Maybe being a bit difficult today.
And it also really, really brings your learning to life, because it's great to look at books and to look at PowerPoint presentations, but when you can see this in that three-dimensional way, it really makes things come to life, and it makes you understand the concept of things a bit better, I would say.
We also use these headsets with Lucina as well, so you can see inside her what's going on. Because obviously she actually delivers a baby, but it allows when they disappear, you know, say if breathe upside down,
Yeah.
anything like that, it allows them to see what's actually going on inside Lucina as she's giving birth, which is very insane. I think.
And even if it's just a normal birth, it shows the mechanisms of labour, so it enables the student to get a true grasp of what it's like when that baby turns and positions itself to get and negotiate its way out of the canal. And then, of course, we've got our desk here as well, the ward station. So this is exactly like a hospital ward would be.
I think we're so far, especially here at Middlesex, we're very big on the simulation side, and it seems to be a very, students seem to be very excited about it as a way of learning. And especially when we go to StoneX, we're going to have we're going to have like an A&E.
Yeah, we're doing that 3 stories, aren't we?
Yeah, it'll be insane. And then we've got more mannequins coming that do, especially a few more high fidelity mannequins like we've seen now, the Super Tory, where they can do so many different conditions on them as a way of learning and experiencing, you know, a real life scenario.
The mannequins are getting more realistic, more advanced as time goes on. We're getting some new ones in, which are basically better every single year.
Yeah.
And they're becoming really lifelike.
Yeah. So some of them we haven't got them in yet, but they're 3D model, and honestly, they look exactly like
Like a real person.
Look like a real person. When I walked into the room, I thought something had happened. But it's insane what they're doing now, and the way different ways of learning. It's definitely a very exciting pathway to go down.
Yeah. So I hope you've enjoyed our little whistle-stop tour of Middlesex Skills area, and enjoy the rest of your NHS careers there. Thank you.
Thank you.